let's talk now about something that we all should get concerned about. South Africa's medical emergency. Overworked, underpaid, with few resources and often poor security. These are some of the challenges doctors and other healthcare workers face, and many are now fed up. They're packing their bags and they're leaving. Just yesterday, you remember, we spoke to the CEO of Helen Joseph, a major hospital in Gauteng, and she confirmed that staff had contracted gastroenteritis because of a lack of water. A recent survey indicates as many as 40% of our doctors want to emigrate. What about those in the pipeline, you say? Well, the placement of interns and community service doctors is a challenge. Almost every year, you know this. It almost feels as if there's no plan, as if nobody knew they were coming. Could we soon run out of doctors? Dr. Mark Human is South African Medical Association Gauteng branch chairperson and joins us now on the line. Both SAMA and DENOSA, the nurses union, are sounding the alarm about this. Doctor?
Good morning, Bongani, and good morning to your viewers. And absolutely, yes. And it's not soon. We have run out of doctors. We are way below recommended numbers of doctors per capita. You know, even if you quote the official figures, which come from our government, which are horribly inaccurate, and I'll explain why, we sit at 0.8 doctors per 1,000 members of the population. The World Health Organization recommends a minimum of 1, and most countries of our economic status sit over 1.5. Many sit over 2 doctors per 1,000 members of the population.
Please explain to me why that ratio is bad. I mean, not just in terms of comparatively speaking, 0.8 doctors per 1,000 patients. Why is that bad?
It just means that the amount of people that you are being forced to deal with is it's basically a physical impossibility. You just don't have the time or the available hours or manpower to be able to deliver the medical service appropriately. Bear in mind that ratio is if you divide all the doctors, but you're not taking into consideration that doctors fall into very many different fields. If you condense it just down to general practitioners, then you're much closer to sort of 0.1 doctor per 1,000 people, or even less than that. So it basically means that every GP is looking after 10,000 people, and that's just practically unsustainable.
I mean, it's tried to point out no health system can function optimally if it's got a skills shortage.
Completely. And this is not something that just snuck up on us overnight. Like load shedding, it's been coming for a very long time, and we've seen it. We know we train way too few doctors. We train 4 doctors per 100,000 members of our population. Most countries worth their salt, and again, I'm not judging us against most of the European or OECD countries. Most countries of our economic status train 10 or thereabouts doctors per 100,000. So we're way below half what we should be training. If we doubled our medical school exit, the number of doctors we qualify every year, we doubled that overnight, it would still take us well over a decade to reach that goal of the World Health Organization.
And part of the difficulty, as I mentioned in my introduction, is that, as you say, we're not only not training enough new doctors, but the pipeline of entrants every year, I can't remember the number of times that I've spoken to applicants, family members, and the fraternity at large, junior doctors who want to work but can't get placements.
Yeah, it's difficult to understand why the placement numbers and the intern numbers don't match exactly. Actually, there should probably be a few more intern posts because 1 or 2 people drop out or fail or something like that. But there should probably be more interns than 60-year medical students. They know, they can see this number coming from a few years before the government. But there's a mismatch between national health and provincial health, and it always turns into a disaster. Even when national health thinks that the post exists, then provincial health says that they don't have the funding for it. So, and that's just at intern level, you know. We shouldn't be basing our service on interns.
Gosh, and then there are the working conditions, aren't there? Doctors getting raped or robbed. I mean, we're now hearing they have to bring their own water, sometimes food for patients.
Well, there have been reports of water shortages all around Gauteng recently. It's supposedly due to load shedding causing inability to fill the reservoirs. Of course, again, anyone could have seen this coming and planned for it. Built-in reservoirs. I understand some of these hospitals have boreholes, but they're hopelessly inadequate. Look, what we haven't spoken about is our retention strategy. It's all very well that we don't produce enough doctors. That's the one side of the coin. The other side of the coin is that doctors, we're inherently wanting to help people. And if you are completely hamstrung in your abilities to do so, you will move elsewhere. And that is why so many doctors are looking at moving elsewhere. It's got nothing to do with salary.
Yeah, but the minister says, look, there's nothing to see here. Doctors are a scarce resource. Ours are well trained. They've always been in demand elsewhere.
He's dead right, and there's always been a progression from that four loose grouping of poor, 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 rich, rich, poor, and rich, rich countries. So most doctors tend to move up a tier if they can, or if the opportunity arises. But we not only that, we obstruct those coming from the tier below us. So it's extremely difficult to come from a foreign country and practice in this country. There's so many obstructions are thrown in the way. South African qualified, South African born people who've gone and specialized overseas can't even come back, because then they have to go back to write their exams, even if they've been practicing for a decade. So some of the rules that we've put in place just really don't facilitate the flow of doctors, which we know is inevitable.
The Health Professions Council, though, will argue, but how do we know which countries are on par with us, have parity with us? I mean, we can't just take people, we can't take their word for it that they can do this. It is necessary to make sure that they can pass our standards and meet them.
100%. No one's saying we need to lower our standards. There needs to be a measure, but the measures that are put in place at the moment, redo 2 years of your training, that kind of thing, they are completely overkill and will discourage people to move. Surely you can just apply exams and work out who knows and who doesn't know. And of course, medical schools and countries can be rated much the same way as we were in the 80s and 90s. You could qualify in South Africa and pretty much go and practice anywhere in the world then. That's not the case anymore.
Gosh, and of course, for those doctors who are trying to alert authorities and the general public about the conditions they are dealing with, when they do speak up, they're victimized. I mean, how many Dr. Tim de Meyers are there?
I think there are very many, but very few as brave as Tim. And the bottom line is that people fear for their job prospects, and probably even more than that. I think the victimization can go much deeper than just losing your job. So I think people are very fearful. If you just have to look at some of the petitions that have been started, the latest one about water in Rahima Musa and Helen Joseph is started by concerned citizens. They're too scared to put their own name to these.
In what other ways can they be victimized, if not just losing their job?
Well, we all know about the Beta Dirka run. We all know about the Tembisa Mafia. I mean, and all of this is part of the same rotten can of worms.
Is part of the problem that the system often has non-clinicians in charge of major institutions? I mean, I know ex-school teachers who've been appointed CEOs of major hospitals. Is that part of the problem?
Absolutely. I think it's extremely difficult, and I'm not downplaying the skills that any of those people have, but it's extremely difficult to understand clinical priority setting if you haven't got that medical background, be it even through nursing. You've got to have that, and you've got to have management skills, which sadly most doctors lack. So when doctors get appointed, they don't know how to manage. They know what's the right thing to do. And when you appoint a business manager, they don't know what the right thing is to do, but they might know how to manage. And some, of course, don't know either.
But I've spoken to some of the people that are in charge, and you can take your pick from Dr. Joe Phaahla, Dr. Sibongiseni Dhlomo, right? Those are the two most senior politicians in the Department of Health in the National Department. There's people like Dr. Nicholas Crisp, for example. These are medical people with a medical background. What are they saying? How do we fix this, right? Because the problems are clearly endless. But is there a plan to fix it, to reverse the slide, to arrest it maybe?
One feels that the government led by the leading party have put all their eggs in the NHI basket, and certainly if you speak to any of those three politicians that you've just mentioned, NHI is the glory boat to fix this kind of thing. But NHI is like applying a highly sophisticated funding model onto a vehicle that doesn't have wheels. And that's the big problem. We need to fix the vehicle long before we start to implement a single purchaser type sophisticated fund, which, by the way, has blown out hopelessly in very sophisticated situations like the UK. The NHS is in a mess at the moment because they just did what we are still trying to do. And everything that the government says comes out about NHI. Maybe they should look at the cause of the problem and fix the little things before we start to try and implement something way too fancy and sophisticated.
And we know what this government is like once it's stuck on an ideological idea or position. Dr. Mark Human, appreciate your time. South African Medical Association Gauteng branch chairperson. Well, there you go. It's a problem that's been coming for a long time, he says, and much like load shedding, we were warned. We are now here, and in his assessment, unless intervention happens, it's about to get a whole lot worse.
Current events, developing stories,
tough questions.
your voice making a difference.
This is Breakfast with Bongani Bingwa.